Robin Shumaker. I was volunteering in La Ceiba, Honduras from May 15th until June 26th in the Hospital Regional Atlantida and the Metropolitan Centro de Salud. My broader view coordinator was great whenever any of us had questions, concerns, or weren't happy with something. He worked with me on many occasions to adjust what I was doing at the project when I felt like I wasn't being useful. He also worked with me when I decided that I wanted to add 2 extra weeks of Spanish lessons. He also gave us free transportations to and from the projects every day. The most surprising thing that I experienced at the accommodation was how nice everything was. I had a great room with its own bathroom, the food was great, and the cold water and no air conditioning are easy to get used to. The thing that I was most surprised about the country were the happiness of the people, regardless of how poor they are. Many of the people are very poor, but they're glad to smile at you when you smile at them or try to communicate with you even if you don't speak very good Spanish. The most difficult thing to experience at the program was the way that the patients had to be treated because of the lack of supplies. Many times the hospital or clinic requires the patients to buy the supplies for their visits. This was hard to experience because although they're receiving free health care, they often have to pay for supplies for their visits. Also, the lack of public health knowledge is hard to experience. The most difficult thing to experience at the accommodation, nothing was really difficult. Everything at the accommodation was great and I never had a problem with anything. The most difficult thing to experience in the country is the poverty. You realize that you're coming to a very poor country, but when you get here it's harder to experience because you're working with and serving these people every day. Tips for future volunteers about clothing: bring 4 to 5 pairs of scrubs, a few pairs of t-shirts and shorts to change into after you get home from the hospital, and then maybe 1 or 2 nicer outfits. It's hot, but it wasn't much different than what I'm used to. So, tips about donations. I think it's better to keep your donations until the end of the trip. I donated my things as soon as I got here, and there were times when I wished I had some of those things back so that I could use them at the project sites. And then whatever you have left at the end of the trip, just donate those things. Tips about weather: it's hot, so just expect to be hot and sweaty. Wear bug spray and sunscreen. Other things that volunteers should know are your trip will be exactly what you make of it. If you have a bad attitude, you will have a bad trip, but if you're hopeful and optimistic about what you'll be doing or where you're placed, then you'll have an amazing trip and you'll learn a lot. If you have a problem about something like where you're placed or what you're doing, talk to someone about it. They'll be happy to work out something different with you. They want you to enjoy your time here just as much as you do, and if they don't know that you have a problem, they won't be able to fix it. If you want to get to do things at the clinic or the hospital, ask. Even if you don't speak Spanish, you can usually communicate with the doctors and nurses that you want to help. Many times they won't offer to let you help, but if you ask, they'll be glad to let you. My time in Honduras was unbelievably amazing. I got to see and do things that I would never have gotten to do at home. Things didn't always go the way that I expected, but that's the way things are here, and you just have to roll with it. Your time here will be so much better if you just take everything as it comes and make the best of it. My accommodation, meals, and security were way better than I expected them to be. I'll miss the food here for sure. I never felt unsafe, and my accommodation was much nicer than I expected it to be. It made the trip so much easier. My favorite memory of this trip in the program was that because I was here for 6 weeks, I had a chance to really get to know many of the Honduran medical professionals. I made really good friends with some of the medical students, which was awesome. They're really awesome people, so make an effort to get to know them. My favorite memory of the country was all the amazing things that I got to do on the weekends. I went rafting, hiking, snorkeling, ziplining, and to the beach and pool. Do not waste your weekends because they will be some of your best memories of the trip. The broader view support prior to my trip was amazing. I had a ton of questions and they were always answered in detail and very quickly. The website information or the information that the website gives about this trip is very accurate. The testimonials from previous volunteers are what helped me prepare the most for my trip, and I'm always willing to speak to other volunteers. I found a broader view by deciding that I wanted to volunteer abroad this summer, and I looked at several different programs, but a broader view had the highest ratings with the most reviews.
Okay, thank you, Robin, for volunteering with A Broader View Honduras. Have a safe trip home, and we hope to see you back very soon.
Thank you.